The most hours you've ever worked in a week?
So it's 145 hours, and I know it sounds crazy to a lot of you guys out there, but it's real. So when I was in beginning my neurosurgery residency as an intern, there was a week when we took call every other night. And so as an intern, you're up all day, and then when you're on call that night, you don't get any sleep. You're up all night, and then you go into the next day, you're up all day, and then I'm off that night. But we wouldn't finish rounding till like midnight. And then you have to be up like at 3 a.m. or earlier to pre-round on the patients to get all their vitals and know about every patient on service. And we had like 30 or 40 patients on service. And then you have to present to the resident, then the attending. So you only get like 2 or 3 hours of sleep that night. Then the next day I'm on call again, don't get any sleep that night. Then the next night I'm off, but I only got 2 or 3 hours sleep. So I got minimal sleep over that week. I remember when at the week's end, I was being called down to surgery, and I was like, couldn't hardly think. And I called my wife Cindy, and I said, Cindy, I can't go down to surgery. And I just told him I couldn't come, and I stayed in the call room and got some sleep. But that's honestly how many hours I worked in 1 week.
And was that like the 1980s, early 1990s?
That was 1993.
And has residency changed since then?
Yeah. Well, at the end of my residency, I finished residency in 1999. A year or two before that, they had a new law where you could only work 80 hours a week because we were working too much. And remember, I was only an intern, so I'm not in there operating on people. I wasn't making life or death decisions, because I know a lot of people worry about that. It's not right how we stayed up so much, but on the other hand, I wasn't performing high-level task at that point.
Yeah, interesting. And what's the longest surgery you've ever performed?
So the longest surgery I ever performed, that again was in residency. That's when I was chief resident. And so it was a big, complicated, deep brain tumor up against what's called the brainstem. And it was one of these cases where we had all the monitoring set up on the patient. It took hours and hours just to gain access to where the tumor was. And then you have to go very slowly over this tumor because it's right up against the brainstem, and the brainstem controls if you're awake or asleep, if you're in a coma. It controls your heart rate, your breathing centers, all the strength of your arms and legs. So it's a very target-rich area. So the surgery went very, very slow. And then when you're done with surgery, you have to close it up, which takes hours and hours. So it was a 15-hour surgery that started early in the morning around 7 o'clock, and we finished around midnight or somewhere into the wee hours. If you're enjoying this video so far, then please subscribe to my channel.
And what's the most amount of surgeries you've ever performed in one day?
For me, that was actually in private practice. It was 8 surgeries. So one day I had 6 elective surgeries on my schedule, and then I was on trauma call that day, and there were 2 emergencies that came in that I operated on in the late hours and early morning of the night.
What's an elective surgery versus a trauma surgery?
So elective surgery is somebody that I'll see in the office. They come to me for a problem like pain in their neck or something that's not emergent, and then I'll put them on my schedule as an elective surgery, as a non-emergency surgery. That's opposed to when I'm on trauma call, if someone comes in with a bad head injury and they need surgery on their brain, we take them urgently or emergently to surgery.
And have you ever lost a patient during surgery?
So I've never lost a patient during surgery. I've never had a patient die on the operating table, but patients who had bad head injuries or really are very sick, sometimes they get into the intensive care unit after surgery, and then they end up passing on there.